Hi, good morning, everybody out there. It's a very strange experience talking into cyberspace. Uh, um, yeah, and we're not used to the platform either. So forgive us if we get a bit confused, or if I do. I'm sure the others will be fine. I'm Jenny Popey, and I'm going to be moderating and chairing this session. At the moment, you can see Margaret Ogden and Fiona Ward, who are going to be doing presentations for us, and Michelle Collins, who is my deputy as coordinator for public involvement and engagement in the school. We're going to be talking about evaluation of public involvement in the school. But we've got Fiona, who's going to be talking about an evaluation she did in the Collaboration for Leadership and Applied Health and Social Care Research, a mouthful, which is now actually being replaced by the Applied Research Collaboration for the Northwest Coast. And I worked with Fiona on that evaluation, so it'll be it's very relevant to what we're trying to do in the school. And then Margaret is a public partner in the school, as well as in many other aspects of research, and she's going to be talking about her experience. But first, I just wanted to do a bit of an introduction to locate those two presentations. So the first thing I wanted to just highlight, I mean, we're not sure who the audience is, so some of you may already know this, but I wanted to just explain the complexity of the school a little bit. So the public partners are involved in the school at a number of levels and in a number of ways. They're involved in designing, conducting, and the governance of specific projects or work packages. They're involved in the governance of research programs and themes, the themes were described in the plenary session just prior to these workshops. We've got 3 research programs and 3 themes. They're also involved in the strategic management of the school as a whole, so in our executive group, our advisory group, and in the strategic governance of public involvement in the schools. So we have a public partners network, the PAN, which has a governance subgroup, and so members of the public are involved in our strategy group and things like that. So they're involved at individual project level, at program level, and at cross-school level, which means that an evaluation of public involvement, the experience and impact of that has to be at these different kinds of levels. So why do we want to evaluate public involvement? So next slide, Michelle, please. Thanks. Well, the most obvious thing is that we don't want to do any harm to anybody. We want to make sure that actually public involvement is a positive experience for the members of the public who give their time and intellectual capital to us. So that's really important to look in evaluations both at the positives, but also where it's not going so well. But in addition to that, absolutely core reason for doing an evaluation, we want to capture the learning from what we're doing so that in the next 5-year phase, the third 5-year phase of the school, which starts in March, we can do it better. We can learn, we can move good practice into the school, but also improve where we know we need to improve. We want to provide feedback to the public partners who have given their time and energy to ensure that they understand and that we appreciate them, that we value them, what impact they're having. It's really important for the public partners to know that they're having an impact, they're being listened to. And we also want to contribute to the wider evidence base for public involvement, and understanding about what impact it has on the research process, on the people who are involved, on the researchers who are involved, and on the findings of the research and the translation into practice or policy. So we have a number of principles that will underpin this whole school evaluation. And the first one, which is really important, and both of the presentations will highlight this, is that we want public partners to be involved in designing and conducting the evaluation itself, and in understanding the results of the evaluation and thinking through the implications of that for what we do in the school, as well as for the wider public health research community. We want to build on evaluative activity that's already going on. The school has 8 academic members And as we said, we've got these 3 programs, 3 themes, multiple projects. And we know that a number of projects are evaluating. The programs are either monitoring rather than evaluating public involvement, but there's also quite innovative evaluation going on. So we don't want to duplicate. We don't want to get in the way of anything that's already going on. We want to complement the existing, probably somewhat patchy attention to evaluation that's going on in the school. We want to ensure that the findings are useful and relevant to improve our approach. And I think by involving the public in the doing of the evaluation, that will help us ensure that the research, the evaluation is designed to be relevant and designed to be maximally useful. And finally, we want to share our findings within the school, but also much more broadly than that, to inform, to help other research organisations to improve their practice as well. So that's by way of just a context for the 2 presentations. And what we're going to do is have a presentation first by Fiona and then by Margaret. There's a bit of time for questions after that. And if we have, Michelle will end with a few kind of general points about the cross-school evaluation and our initial thoughts about that. And then we might have a bit of time at the end for a few more questions. So first, I'm going to introduce Fiona, who I, of course, know very well. We worked together for a number of years. She's a senior research fellow at Lancaster, and she's currently in the equitable place-based health and care theme within the Applied Research Collaboration for the Northwest Coast. So Fiona, over to you. Thanks very much for coming along.
Okay, thanks, Jenny. As Jenny said, I'm going to talk about the evaluation that we did as part of the Clark. As Jenny said, the Clarks have been replaced by the ARCs now. So the collaboration, the Clark, was a partnership of 36 organisations, and you can see here there were quite a lot of NHS organisations, also local authorities, universities, but members of the public as well, and businesses to some extent, and third sector organisations. So quite a varied collaboration. And the Clarks, broadly speaking, were the purpose was to undertake research, health-related research and implementation projects that will improve health outcomes. And for us in Clark Northwest Coast, health inequalities was a particular focus as well. So I was one of the researchers in the internal evaluation. Public involvement was one element of this, but we were also looking at partner involvement, building capacity, and also embedding health inequalities in the collaboration. So today I'd just like to talk briefly about why I think evaluating public involvement is important. Luckily, I agree with Jenny on a number of points there. Describe the approach we took in Clark Northwest Coast, and say what I feel worked well and what in hindsight we could have done differently. So first of all, why evaluate public involvement? First of all, public involvement, it's an integral part of the health research process, quite rightly, and it requires a considerable amount of effort, investment of time and energy from all concerned, so from the advisors, from researchers and from other practitioners as well who are involved. We need to make the most of that input and ensure it's valued, and also encourage further involvement by providing feedback to public advisors. Oh, I should say in Clark and in the ARC, we call it the public contributors, public advisors. So I'll be using that phrase quite a bit. And taking on board the results of the evaluation can result in a better experience. It can improve research planning and identify where changes are needed. So that cycle of feedback and improvement. At the organisational level as well, if there are deficiencies, it's about acting on the findings. It can help develop the culture and structures that are supportive of public involvement. So it can point to, for example, where policies and training and support is required or needs developing. And more broadly, evaluating public involvement in our own organisations or collaborations can enable us to share good practice, both internally and externally, facilitating the wider development of public involvement, researcher skills, organisational infrastructures, public involvement processes and procedures. So the approach we adopted in the evaluation of public involvement in Clarke North West Coast included an examination not just at the scope of public involvement. There was an aspiration to involve the public at all levels of the research process and in the governance of the programme. But we also wanted to look at the experience of public involvement. So we sought information from public advisors and professionals about how the involvement was experienced, and looked to examine the influence of the members of the public who were involved as well. So there are a number of elements to the evaluation of the Clarke. The Clarke was made up of a number of different themes, and 3 of these conducted their own evaluations, in addition to the cross-cutting evaluation that I was involved in towards the end of the programme. So the information was collected from different themes in different ways, including workshops, interviews, and focus groups, and so on. And across all of these evaluations, the thematic evaluations and the overarching cross-cutting evaluation, almost 200 people were involved, 59 of whom were public advisors. So there was input from, as you can see in these circles, a range of different people in different positions within the organisation and the collaboration, from the steering board management team to core staff who are usually researchers, but also interns, PhDs, and the partner organisations as well as the public advisors and third sector organisations. And in addition to public advisors being involved as participants in the evaluation, we had a core evaluation group which included 2 public advisors and then a wider public advisor evaluation subgroup which met 4 times over the period of the internal evaluation, the cross-cutting evaluation. So in terms of what I think went well, first of all, we gathered views about public involvement from a range of perspectives. So we were asking the public advisors, but we were also asking everybody else who'd been involved in the collaboration about their experience of public involvement, working with a range of staff, but also looking at public involvement in the management and the governance of the programme. In terms of the evaluation, the contribution of the public advisors in the core group and the evaluation subgroup was extremely important, and they were involved in a range of activities, including the planning of workshops to collect information from other advisors, in the data analysis, and also in the prioritisation of the findings. Another thing I think went well was how we thought about the different dimensions of public involvement in the analysis. So to do this, we used 2 different frameworks. First of all, we used a mainstreaming framework. So we looked at the extent to which public involvement was built into the organisational culture, the language, the policy and structure and the practices of the collaboration. And perhaps you can say we did that. You know, there was a thread of public involvement throughout all these things, but we wanted to look at the quality of public involvement as well. And to do this, we used the involvement cube. This focused our attention on the strength of the public voice, the way that public contributors were involved, the extent to which the research activity and governance activity addressed the organisation's concerns or the public concerns, and whether the collaboration was open to change. And this is Andy Gibson's involvement cube. You may be aware of it. A lot of previous research has focused at the project level, so the aim of our approach using these two frameworks was to think about the contribution to sort of long-term processes of transformation of attitudes and policy and culture and procedures, as well as the immediate evaluation in terms of particular projects or pieces of research. So on reflection, it's important, in hindsight, could we have done things differently? And I would suggest there were a number of things that could have been done differently. The first thing would have been to have an agreed approach and set up data collection processes sooner. So as I mentioned, the cross-cutting evaluation took place in the 4th year, with the theme evaluations taking place at various points earlier than that. So differences in approaches are good, that's fine, but the coverage of public involvement and other topics in the theme evaluations was a bit variable, shall we say. Some had limited information about public involvement, and it would have been better if we'd have had more similar questions to collect information about the scope and experience of public involvement in each of these theme evaluations. It would also have been beneficial to have similar data. We tried to collect data around the public involvement, for example, about induction procedures, training, when and how members have been involved in the research process. And we attempted to collect that when we were doing the cross-cutting evaluation, but in some cases it was difficult to get that information. I think Clarke would have also benefited from an interim report. So if the evaluation had been phased, the learning from the evaluation has been used in the development of the ARC in the North West Coast, but it would have been much better to have feedback and time to develop practice within the lifetime of the collaboration. If there'd been an interim report or more sharing of information and discussion of findings, areas that were problematic or where there was a lack of consistency or clarity, could have been addressed earlier. And finally, one element that wasn't really addressed in the evaluation but could have been useful was the approach of partner organisations to public involvement, in addition to the approach in the collaboration. And if this had been undertaken early enough, it would, for example, have informed conversation with the staff from those partner organisations. We would have understood perhaps more where they were coming from, what their previous experience might have been, identified areas where they might have benefited from support within their organisations. And it might have also been an opportunity for Clarke to have learned from good practice in their organisations. So that's a quick summary of our work in the Clarke. We did produce a journal article referenced here that was published last year, and the names here on the journal article are largely the people who were involved in the core group. So thank you for listening. I hope this raised some interesting points for you.
Okay, thanks very much, Fiona. We don't have any questions yet, and we have this tricky thing of questions being put in the chat or the QA. Can I encourage people who are listening to please put some questions in? You can put it in the chat or the QA. We monitor both. So just to set us off, Fiona, it's interesting that issue about, you've reminded me of the complexity of the Clarke, but actually the school has many similarities with multiple partners, multiple levels. And and we haven't started an evaluation right at the beginning. We're repeating the same mistake, I suppose, although, you know, I'm not sure it was a mistake. It's kind of just real life, isn't it? That's where we were and that's what we did. I wonder if you could just say a little bit more about the two theoretical frameworks that were used, the main, how that, you know, how they worked, and what you think were maybe the advantages of. Well, you said a bit about the advantages. Would you use them again if you were to do this again? And if so, would you use them in the same way?
I think I would use them again, yes. So I think the mainstreaming framework, which was the reference for that was Moser and Moser, and that was developed quite a number of years ago. It was very good at helping think about the sort of underlying organisational philosophy, policy and procedures, and how they were put into practice, which I think can be forgotten. So often looking at the experience in particular projects, which the involvement cube was really a useful way of doing. And I think needs to be done as well, obviously, because you're looking at the quality, more the quality aspect with the involvement cube. But I think the Moser and Moser framework for mainstreaming did focus attention on those broader overarching issues around the structures, but also the underlying philosophy. Again, I suppose we thought about using those frameworks later on, and that would have been useful if we'd have thought about them earlier, because that would have helped structure the evaluation a bit more. And I think other ARCs have used the involvement cube as used the involvement cube as well. And to think about those different dimensions of, you know, the extent of involvement, the strength of public voice, and whether the organisation was changing over time on these different dimensions would have been useful. So yes, would use them again, but also would think about how we talked about public involvement in that way earlier on in the life of the collaboration as well.
Right. Okay. I can't see any questions. I'm not sure if Morella's, so I'm gonna take the opportunity to ask another question myself, really. On the public involvement side, is there any kind of learning about how that was done, that involvement in the evaluation? We had that panel, we had the panel and the members of the actual team, so peer researchers really, equivalent. What would you say was the learning about that model of the subgroup and the members of the team?
I think it was useful having a small number of members of the team in this part of the core group, as well as having a wider group who we could sort of reflect. We talked to them more broadly about the findings and some of the analysis, and thinking about quotations that we used from the interviews. But the members of the core group, we were able to work with more specifically on analysis, and they really liked how we used the involvement cube. They found that quite helpful in thinking about the different dimensions of public involvement, and they looked at transcripts, sections of transcripts, and thought about how people were talking about those different dimensions that are on the involvement cube. So they found that a useful tool, and they were more involved in the analysis of the data than the wider group. So having those two levels was quite useful.
Okay.
Yeah.
We've been asked if you would say just a little bit about some of the findings from the evaluation for people who haven't read the paper. I know you weren't asked to think about that, but if you can bring them to mind, just a few key ones for us.
Right. Okay. No. This was a while ago. Yeah. The findings of the evaluation. It's something I should have looked at in more detail. Yeah, I think overall, there was a feeling that we were working towards embedding public involvement in the collaboration, that we hadn't got there by the end across the whole collaboration, and that it was to some extent patchy. There were some themes where public involvement was definitely more embedded within the work of the theme. There was one theme, for example, where there was some public involvement in the overall management of the theme, and other themes where it wasn't evident at that level. There was public involvement in the steering board, and but I think there was some question as to how strong the public voice was in the steering board. Public advisors were present, but how strong their voice was. But maybe also in terms of the steering board, the partners perhaps felt that their voice wasn't so strong. So it wasn't just public involvement. You know, there were other aspects of involvement that were developing through the life of the programme as well. We also found that some themes were perhaps not following perhaps the procedures of the collaboration in terms of public involvement and involving public advisors in the way, or members of the public in the way they previously had. So there was something about people's understanding of the overall philosophy of public involvement in the collaboration, and not necessarily following the same procedures or following the procedures of the collaboration. So I think there was a view that things were developing throughout the lifetime of the collaboration, even though it was 4 years, but things were positive, but still developing. And I think that was why the learning was really important for the ARC, and has been used. So the ARC started off on a different footing from where the Clarke did, obviously, and has benefited from that experience.
Okay, that's great. Yeah. Ashley says she's sorry for putting you on the spot. She just wanted to learn. There are questions are coming in now, but we kind of need to move on. Fiona, that's really, really helpful, and we clearly need to go back to the paper, because I think there is some really useful learning for us. And those two theoretical frameworks, I think they did work really well. We just used them too late, didn't we, as you say? So I think to use those to shape the actual evaluation rather than to shape the analysis is a good learning point for us. So we might come back to you for some more memory joggers about that. So thanks very much, Fiona. So can I introduce Margaret Ogden, who is a public partner in the school, as I say, has experience of being a public advisor to a number of research projects, not just within the school. And interestingly and importantly from our point of view today, she's been involved in evaluations of public involvement in research, and that's what she wants to talk about. So Margaret, I'll hand over to you. Thanks very much indeed.
Thank you, Jenny, and thank you to everybody for the opportunity to speak to you today about this. It is my passion. It's something I've developed a bit of a specialism in. So the first thing is, why evaluate? I came up with this quote: if we are serious about involvement, we need to be equally serious about evaluation of impact. And the fact that over the past 10 years, international literature evaluating PPI has more than tripled. And I think that gives credence to the aim of evaluating PPI. My experience of the how has been keeping an impact log, which has been absolutely great. Usually it's researchers that keep that impact log, although there has been one occasion when I've been asked to keep control of that as a PPI member. And my other experience is undertaking a full PPI evaluation which was much more involved. And I just put the question out there, or both. Should it be a combination of both? My project in the SPHR programme was called CLAD, Community Engagement in Alcohol, with a researcher called Jo Reynolds. And this was an evaluation, but it didn't have a huge focus on impact. I think I had made an impact in the project. I'd spoken at length to Jo about problems of alcohol when I was caring for my grandmother, and also about how a local authority engages with the public. That was through having 35 years with Durham County Council. A focus group was held in Sheffield, and if I can just explain, this was a little bit on the back of the CLAD project, because we couldn't do an evaluation. We would have liked to, but we hadn't gone for ethics approval. So this was a different kind of evaluation, and it was about patient experience, and in particular the journey into PPI. So there was a focus group, and PPI coordinators attended, and other professionals such as managers. So there was a diverse group of people. And Jo was chair, and the other researcher, Ruth, and I were there for note-taking. Data was collected and analysed using thematic analysis, and findings were subsequently published. And PPI members had been interviewed in locations which they preferred. And I remember Jo coming up to County Durham and interviewing me at length, and then coming up a few weeks later and doing a more in-depth interview. So that was getting more rich data, and she did that with the other participants as well. Measuring impact. PPI members completing feedback forms post meetings, and that's something I'm particularly keen on. One university has been excellent at carrying that out, but of course you've got to ensure that the PPI members buy into it and are quite happy to fill in the feedback forms. So in this particular situation, we haven't got enough data. So there's only a few PPI members who've actually completed the forms. So we've had to abandon that idea. And the other is researchers keeping an impact log. It's got to be updated. It's sometimes in the form of you said, we did. And I've seen other mechanisms of using that, such as a PowerPoint presentation from team meetings as a means of feeding back. So yes, the challenge, not having enough data to give you a full picture. I would say that is the big one. PPI members failing to complete the feedback forms, and for newcomers, perhaps they need a bit of support in completing those feedback forms. So that's one feature that I've learned recently. My preference would be a combination of both, looking at impact and also a full PPI evaluation. The need to have specific details of impact, yet the need to see the overall picture. But be aware of the intangible benefits of PPI. Often PPI members talk about having felt they made a difference, but they couldn't quite quantify that. And the domino effect, a contribution you give at a meeting that may not be able to be taken up at that point, but maybe later in a project or even several projects down the line. And that would be particularly difficult to capture especially where you have a change of staff and a change of PPI members during the project. And challenges of evaluating PPI in public health, compared with illness-specific research, they may be quite different. I always give the example of a cancer patient, could quite easily probably see the impact they've made if they're discussing invasive tests and treatments. But a PPI member in public health, for instance, a topic like evidence synthesis, that's something that I've particularly been involved in at Sheffield. And it's such an abstract concept, and some of the PPI input can be quite abstract too. So that may be quite a challenge to evaluate. Public partner involvement in analysis, that's my baby. I love thematic analysis and helping to develop a coding framework. But you do need to consider training needs, and for thematic analysis, that really needs to be one-to-one. Data needs to be fully anonymised before you let PPI members have any involvement in analysing transcripts. And be aware of the time it takes. You need to plan well ahead and allow sufficient time. When reporting your research findings, consider offering co-authorship to PPI members. There may be one or two who'd be interested in that. And find a home for your report that's going to have impact. For example, the research involvement engagement publication, which I believe was set up by PPI members, and a conference such as International Perspectives on Evaluation of PPI in Research that was held in 2018 in Newcastle. But I have kept looking, but I can't see any plans for another one to be held as yet. And the process can be lengthy. One evaluation, even after we'd completed it, it took a year to be published. So there is an element of having to be very patient in this. So yeah, that's been my thoughts on PPI evaluation. I would certainly recommend you to be involved in it. I think it's a wonderful thing to do, and to have that end product, it's just great. So thank you.
Very much, Margaret. Really thought-provoking presentation. As a very interesting experience. I'm just waiting for any questions to come in. But before we move to Michelle, I just wonder, I'm intrigued by your comments about intangible effects and the domino effects. I wonder if you've if you could give us a bit more detail about the intangible and an example of the domino effects. I think they're really interesting ideas.
Yeah, I mean, one of the areas I work in, palliative care, it is something that's very sensitive, and I quite often raise issues that perhaps other people may not raise. And the one example that comes to mind was an online platform. I mean, it's even more meaningful to me this now when I think about COVID and how it's transformed communication. But we were talking about palliative care, and I just pointed out that the minute you open up a platform and you're not in control of what people put on that platform. And I just gave an example of end of life and how, some people might raise the issue of dignitas and assisted dying, which isn't legal in the UK, but in other countries in Europe. They might have a different perspective on that. And you wouldn't have control of what went onto that platform necessarily, unless you put a lot of safeguarding measures in place. And I think that was an example of talking about a really wide issue that may not have been raised if the PPI member hadn't raised it. You know, it's something that the professionals know. It's there in the background of people's minds sometimes, but it maybe wouldn't have got into that strategic meeting. And it was something that the palliative care consultant took on board immediately, you know, that it would be something they would have to. So I couldn't see any sort of tangible thing for me there,
Right.
but I'm sure there was. And it's very hard to quantify just what kind of impact you have when you make a really big statement.
Okay, that's really interesting, Margaret. Thanks. So I'm going to hand over to Michelle to just give us some thoughts. Right. So there's a question just before I move to Michelle. So did you provide incentives to complete the feedback forms just for tips? I mean, I think this issue of response rates is really interesting, because I think I'm just wondering whether we should come back to it after after Michelle's presented, because I think, Fiona, we had some problems with the response rates as well. So, and that was the professionals as well as the public members. So maybe, well, Margaret, now with those feedback forms where the response was low from the public partners, did you provide an incentive, or was
no, and there was an incentive for me because I knew that completing feedback forms could probably result in a full evaluation.
Right.
So I bought into it from the beginning, but it was quite difficult to complete.
Right.
So there was questions around whether you were adding to or having control or being part of the decision making, leading, and those kind of again, it's more abstract for a PPI member to complete those sense of impacts. And I did feel that for the new members it was too big an ask.
Right. Yeah.
They were very good at given lived experience, really good. And they had very strong, relevant experience to feed into the project. But asking them to go that extra yard and, give something that had quite a professional element to it, I felt was asking a lot. But looking back, I did think if they'd used as buddies to try and help and support these ladies to complete the forms, because really it's very rich data if you do complete them, and you don't have to backtrack. You've got the information as you're running along. And it was just a wonderful way of engaging for me, but I could see that for the newcomers, it really wasn't wonderful. It was quite hard.
Right. So doing it with a kind of peer, through conversations really is what you're saying, rather than giving somebody a form to fill in. Really.
Yeah, I mean, I wouldn't have interfered at all with what they wanted to feed back. And I wouldn't have sat over the shoulder and watched them complete the form, because confidentiality is so paramount with this. It's just like any research project that confidentiality of data must be maintained. And even when they let me see transcripts, they're fully anonymized. They're usually PPI members I don't know, so I can't guess who they are. And all those things are really important to take on board.
Yeah. Fiona, do you just want to comment on response issues before we go to Michelle?
Yes, as you say, we did have difficulties getting information from some of the themes about various aspects of public involvement, but I think it maybe relates back to the point I was making about starting earlier and having some interim reporting of findings of the evaluation so that you can sort of learn. And it's about everybody understanding. It's part of the mainstreaming, everybody understanding the sort of culture and the value of public involvement and being clear about the processes. So I think it sort of feeds into a number of aspects there. But the interim reporting is really important. So once, like Margaret says, if people are able to fill in those forms, if some people are able to be able to feedback, demonstrate the value of that information, I think that helps sort of develop the culture as well. It's quite sort of circular. Yeah.
That's great. Thanks, Fiona. Thank you. So, Michelle, do you want to just, you're going to kind of comment on some thoughts about the cross-school SPHR evaluation that we're thinking about? We've had lots of ideas actually about that, I think. So, thanks.
Yeah. No, it's been great. The past two workshops really helping to contribute sort of thoughts and ideas to it. So I just wanted to share a bit of thinking, some of our early thinking around the evaluation. Jenny obviously talked at the beginning about the purpose and the principles underpinning the evaluation. So what I thought it'd be useful to sort of share how we think the evaluation will probably look. So we think there should be an aspect of the evaluation focused on public partner experiences of being involved in the school at different levels, work package, programme and overall school level as well. So something about the experiences of being a public partner in SPHR. We also think there should be an element focused on the impact of public involvement on researchers, research processes, outputs, knowledge exchange and things like that. So that's our thinking about what an evaluation might look like. We're aware that because of the complexity of the school, there's sort of 8 members, work packages, programmes, geographical sort of dispersal, there are some potential challenges of undertaking an evaluation of public involvement that we need to build into our planning. So there's potential challenges around capturing the variety of experiences that public partners have of being involved, because work packages, programmes, academic centres will have their own processes, cultures around public involvement. So we need to sort of make sure we're sort of capturing that wide variety. We're also aware that evaluative activity or monitoring activity might be and has been happening at work package and programme level. So finding out about that is going to be really important in terms of the evaluation. And I think also understanding from a whole school perspective how many public partners are involved across SPHR is something that we need to work on as well. So the work that we've undertaken already on developing the evaluation, we've set up an evaluation working group, and this contains public partners as well as SPHR colleagues. And I think this group will grow. I think it will evolve, and as the needs of the group, we're aware of them, then we can add to it. We've been reviewing progress reports to look for any sort of descriptions of evaluative activity or monitoring, so we can draw on those. And we're working with members of the school's public involvement and engagement strategy groups and operational groups, which have representatives from each member of SPHR in there. So evaluation is a constant theme of our meetings at the moment. And also involving public partners in the discussion about the evaluation. We had a PAN meeting, Public Partner Network meeting yesterday morning, and we began the discussion about evaluation, and we're sort of hoping to continue with that discussion with public partners and involving them in the evaluation. So this is another opportunity, I guess, to ask questions, perhaps about how SPHR are thinking about evaluating. If I hand back to you, Jenny.
Yeah, thank you very much. Yes, and it's quite an interesting time lag between the questions coming up, and so I'm just going to give people a bit of time if they've got any more questions. But in the meantime, Fiona, I'm just going to put you on the spot a little bit again. I know you're not currently very involved in the in the kind of process of public involvement at a strategic level in the ARC, but I just wonder if you could give us any sense of which particular aspects they've built on from that evaluation that we did, and are doing differently now than we did in the Clark Northwest Coast, and I suppose at a strategic level rather than at a project level.
Yeah, certainly at a strategic level, they've been looking much more closely at public involvement in the governance of the themes, and in the day-to-day, really, understanding of the themes. So they've created, so that in the ARC, there are 4 central themes and some cross-cutting themes as well, 3 cross-cutting themes. And each of those has got a public advisor theme co-lead and a deputy co-lead attached to the theme. So our theme on equitable place-based health and care, we have a public advisor co-lead and deputy. They've got an open invitation to come to our team meetings, and at the moment they come to all of the team meetings every other week. We talk to them about the development of anything to do with the public advisor role in the work of the theme. So, for example, we've worked much more on the role descriptions with them and the process of recruiting public advisors to individual pieces of work, so that the processes are as advisor friendly as they can be. At Lancaster, they've actually given these 2 people honorary research fellow status as well, although that's not happened with the other universities that are working within the ARC. But that's very much to sort of value the contribution that they're making to the theme, and I think that's a really good thing. I mean, at the project level, I think it is important as well. There's been much more monitoring from the start of public advisors being linked to themes. So there's a process whereby a spreadsheet where you put in the names of the public advisors linked to each project. So it's clear where there are gaps. Yeah. So themes almost can't not have public involvement in the same way that they were able to before. It was a bit more hidden whether themes did or didn't have members of the public involved in the projects.
Right. Okay.
So that's 2 examples, yeah.
Yeah, very interesting. And I suppose you could see those theme level public advisors being involved in shaping an evaluation so you've got a kind of structure, haven't you, that would enable that to happen more easily than was the case with the Clark.
Yeah, and they've got much more awareness of what's going on in individual themes, so they can take that back to the wider advisor forum to talk about, their perceptions and their experience of what they're hearing about work within the themes. So it's much more open, I think, the information flows, and clear where there are things that need addressing. Yeah. And learning from one theme to another.
Yeah. I think it's interesting because the structure of the ARCs are similar to the school in the sense of they've all of them have got programs and cross-cutting, so there is stuff to learn there. So there's a final question from Ashley. Thank you, Ashley, for your questions. For all of you, really quickly, we've got just a couple of minutes, which is as we all know, evaluation of public involvement in a complex organisation like the school is going to be challenging. So off the top of your head, what do you think is going to be the biggest challenge for us? I'll ask Margaret first. What do you think the biggest challenge for this evaluation across the school is going to be?
For me, it is the abstract nature of some of the topics. Matt Egan presented yesterday and he talked about the Communities and Places programme, And that had been something that was very tangible, and the topics were just so easy to tap into. We didn't need any training or support. It all just flowed. But as I said earlier, something on evidence synthesis, unless a PPI member's done systematic reviewing and perhaps worked with NICE, you know, they're going to struggle with that kind of topic.
Yeah.
And then when you come to evaluate the impact, you're going to have challenges there. And that's what I think is going to be the biggest challenge for evaluation in public health.
Okay, that's great. Thanks, Margaret. Fiona, just very quickly, we're running out of time. What do you think?
I think it's having, from our experience, common information, so you can pull the information together about public involvement. So from such a diversity of projects, to have some thread that actually allows you to pull all of that involvement together, the experience and so on, and the processes together.
Great, thank you. Michelle, I won't ask you because you and I are going to have to manage it.
I was just going to say what Fiona said. I think information. I think information is the big thing.
Okay, well, so we've run out of time. Thank you very much indeed, Fiona and Margaret. It's been a great session. Michelle, thank you for both organising it and contributing to it. It's really, really helpful. Got us off to a good start, I think, thinking about this evaluation cross school. So thank you, and thanks for everybody who's been listening.